good morning. Okay, okay, you can hear me, please.
Yeah.
All right, my name is Nurse Ajaero-ugbo Chidebere. So I'll be taking you today on I'll be sharing with you today's antenatal class. Sorry for the delay. I've been having some network hitches. That's why we didn't start. We are not starting exactly at 11 as scheduled. So before we start, please, I'd like us to pray. All right, our Father in heaven, thank you, Lord, for having given us another session, wonderful session with our mothers. Father, we ask, oh Lord, that you come and be with us, give us the understanding that we need, and that at the end of the day, we will have every cause to glorify your name. Father, we commit our mothers into your able hands. Father, we ask, oh Lord, that you lead them, be with them, and see them through the journey of their pregnancy in the mighty name of Jesus. Thank you. All right, so we're about to start now, and I'll be taking you on care of the baby after delivery. But before we start, please, I'd like to share a screen. Okay. So I want to share a screen. I would like to share a screen with you people, please. All right. All right, can you all see the screen? Hello, can you hear me? Hello?
Yes, ma, we can.
All right, thank you. Sorry. Can you see the screen?
Yes, ma.
Okay. So we're about to start.
Benefits of baby.
Okay, yes. Thank you very much. So I'm starting now. So basically we're going to we are taking, the topic is care of the baby after delivery, and we have subtopics under them, which includes importance of breastfeeding, breastfeeding positions, express breast milk, care of the cord, that's the cord, umbilical cord, cord care, and then bathing of the baby. So starting with the importance of breastfeeding. We all know what breastfeeding is, that breastfeeding is a natural way of nursing a baby with the use of breast milk. And ordinary World Health Organization recommends exclusive breastfeeding for the first 6 months of life of the baby, and this should be initiated immediately after birth. But sometimes there are a lot of factors that may hinder one from initiating breastfeeding immediately after birth, especially when we have our mothers who have done CS, or even those that do vaginal delivery. Sometimes you may have other things you may need to take care of, maybe like stabilizing the mothers before initiating breastfeeding. But it's very important that we should initiate breastfeeding immediately after birth, because breastfeeding has a lot of benefits to both the mother and the baby as well. So benefits of breastfeeding to the baby includes this. It helps the baby to build up his or her immunity. Usually there's a first milk, which we call colostrum, and that colostrum milk is very nutritious and is made up of antibodies and immunoglobulins, which helps to build the baby's immunity, which helps to boost the baby's immunity. Breast milk on its own is naturally packed with vitamins, proteins, fats, and other food nutrients in their right quantity, in their right proportion and amount. So you don't have to worry about, is my baby getting enough vitamin A? Is my baby getting enough vitamin B and all that? So this breast milk is naturally pre-packed in such a way that all the vitamins, all the minerals and all the food nutrients that this child needs to grow are in their right amount, in their right proportion, and in the right quantity that this baby will need them at a particular time. Breastfeeding also helps baby's growth and development. Very importantly, breastfeeding is readily available and easily digestible. So you don't have to worry, is my baby going to digest this food? Unlike formulas that takes time. In fact, some of them even find it difficult digesting some formulas. Even those that will digest some formulas, you'll still find out, oh, that they're not even really tolerating it well as much as they would in breast milk. Breast milk lowers the risk of developing allergies in babies, yes. and also promotes bonding. When you're breastfeeding, it promotes bonding for both the baby and between the baby and the mother, because when you're breastfeeding, you're maintaining eye contact with your baby. Even your baby, even if their eyesights are they're not completely seeing you at that point, but maintaining that eye contact helps to promote bonding. This baby can identify, oh, this is my mother, and there is a sense of care, there's a sense of safety at that point for this baby, and this baby will trust you more. So it promotes bonding for both baby and the mother. So now, benefits of breastfeeding to the mother. For the mothers, it helps them burn calories. Yes, I get a lot of mothers, they are worried about weight gained during pregnancy. So you don't have to worry so much about that, because definitely you're going to lose those weights that you gained during pregnancy after you deliver and by the time you start breastfeeding. So it helps you burn calories. As you're breastfeeding, you're burning calories. So breastfeeding also aids release the hormone oxytocin. Usually we give oxytocin as we are during delivery, which helps mothers' uterus to contract when they want to deliver. But on its own, breastfeeding will help the body to secrete this oxytocin hormone, which will help the uterus to contract and become smaller in size. Like, when you're not pregnant, your uterus is very small. It's like the size of your fist. So after you deliver, obviously the uterus has been stretched. But by the time you start breastfeeding, oxytocin will help that uterus to contract. In contracting, it's trying to reduce that your uterus to the smaller size in which it used to be when it was not pregnant. Breastfeeding reduces the risk of uterine bleeding after birth. Some people do have postpartum hemorrhage, like they bleed after they had delivered. So breastfeeding will help reduce that bleeding, because as it's contracting, it's reducing the bleeding after birth. Breastfeeding also helps to reduce the risk of breast and ovarian cancers. Yes, it helps to reduce the risk of breast and ovarian cancers. Breastfeeding, very important, especially in this our economy with inflation and everything. It saves time and money. So you don't have to worry about, oh, I need to boil water. Oh, my baby is really hungry. Will I have the time to boil water? Do I have the time to start mixing the formula, washing the cup and all that? Breastfeeding it doesn't waste time. Like, it's readily available and affordable, because it's not something you buy, it's something you have. All you just need to do is just clean your nipples and feed your baby. You don't need to worry about is in the right temperature. You don't need to worry about anything. It just saves you time. It saves money for you. And again, breastfeeding also promotes bonding between the mother and the baby. So that's all for breastfeeding, the importance of breastfeeding. So we are going over to the positioning for breastfeeding. Usually there are various types of positioning when you want to breastfeed. But we won't tell you which one to assume. It's one which is comfortable for you that you assume. So you shouldn't be confused about, oh, people are always breastfeeding using the cradle position, and that is what I'm going to use. You use what works for you, because for you to successfully breastfeed, positioning is very important. And if you're not comfortable, your baby is not comfortable when you're breastfeeding, you can't achieve breastfeeding you can't maximize breastfeeding. So positioning for breastfeeding. Feeding correctly takes patience and practice. Yes, we usually advise, even when you're breastfeeding directly, or even when you're pumping, for you to be able to efficiently breastfeed, you have to be patient, and you need constant practice over and over again, because it's not easy. But once you have the patience, you have the time, you're comfortable, then breastfeeding becomes easy for you as a mother, and also easy for your baby to latch and feed as well. So feeding correctly takes patience and practice. Usually it can be so at the first instance when you're just initiating it for the first time, but that soreness usually arises when the baby is not properly latched, because for you to correctly breastfeed, your baby's mouth needs to be tightly fixed around your areola. That's the black spot, the black area, the nipple and the black area around your breast. It has to be properly fixed around that area. That's what we call latching. So if your baby is not properly latched, you can have sores. It can be painful for you. So unless your baby latches properly, it becomes pain-free and easy. Another thing is getting into a comfortable position is very essential. I said that earlier while introducing. I said for you to effectively and efficiently breastfeed, you need patience, you need to be comfortable, your baby needs to be comfortable. So for you to breastfeed, you need to get into a comfortable position. And this will make it pain-free for you and very easy for you as well. The best position for you is one in which you and your baby is comfortable and relaxed. So I'm repeating it again. You don't have to ask one, how do I assume? Which position should I assume? It's a position that is comfortable for you and a position that is comfortable for your baby. That is what you assume. That is the best position for you. The best position for me may not be the best position for you. The best position for you may not be the next best position for the next person. So the best position for each individual is the one in which you yourself as a mother and your baby are comfortable and relaxed. So knowing the ABC principle of breastfeeding, I call it the ABC principle of breastfeeding, is key to breastfeeding properly. And what are these ABC principles? The ABC principle is awareness. When I talk of awareness, I mean you knowing when to feed your baby. Because sometimes babies cry for a lot of reasons. It may be a wet diaper, it may be heat, it may be too much heat, it may be too much cold. So you have to be aware of what is actually making this baby cry. You have to be aware of whether this baby needs to be fed or not. Because sometimes you get a lot of people complain, this baby is feeding every 1 hour. Sometimes it's not just feeding that is their problem at that point. So you have to be aware and be sure that, okay, this baby needs to be fed. Another thing, the big principle of breastfeeding is being patient. You have to be patient because these babies will suck and get tired. You don't expect them to eat as an adult. You don't expect them to rush the food as an adult would. So you have to be patient with them, let them walk at their own pace. Not at your own pace as an adult, because they're just kids, they're just babies. They don't know, they don't have a time. So you have to be patient with them, give them time to suck. Even when they suck, they get tired and rest. Don't assume, oh, because they are resting, that they are filled up. Be patient, leave them there on the breast, on the breast to feed longer. Then the last principle, which is C, is comfort. So basically, positioning for breastfeeding revolves around these three principles. A, awareness, B, being patient, and C, comfort. So you have to be comfortable. I said this at the introduction and I'm repeating it again. You have to be comfortable for you to be able to breastfeed efficiently. And for you to get the correct position, they said it has to be a position in which you yourself is comfortable and your baby is comfortable and relaxed. So for you to also assume a comfortable position and feed well, you need patience and you need to be aware of what your baby needs. So, sorry, please, I hope you can see the slides. So this is a slide of some breastfeeding positions that are being commonly used. You have the cradle position. You can see where my cursor is. You have the cradle position, which is the common position we normally assume, most mothers would assume. So this cradle position, cradle hold, basically you're just sitting. I'm going to explain it further. Basically, you're just sitting with a backrest. And if possible, if your leg is not touching the ground, you may need a footstool to support yourself. Then you carry the baby either on the left or right side, in between the crook of your elbow. So that's just the cradle position. You can also see the football hold. You can see the cross cradle hold, then the side lying position. There are other positions aside these four, which I've highlighted, but basically these are the major four that are really common that you will see people assume. There are other positions for breastfeeding. So You assume the one which is comfortable for you and your baby. So let me explain the cradle position of breastfeeding very well. So basically, you are sitting on a chair with a backrest. You don't sit on a chair that doesn't have a backrest. You can be on a couch, you can be on a bed, wherever. You can possibly use a pillow to support your back as a mother so that you don't have waist pain or lower back pain. And if your feet or your foot is not touching the ground, you can actually use a footstool to elevate your leg just so that you can get that comfort that you need before you begin to breastfeed. So when you as a mother is comfortable, the next thing to do is to rest your baby's head on the crook of your elbow. This is the crook of your elbow here. When like when you're carrying your baby sideways with their whole body facing yours. So while you're carrying your baby in the crook of your elbow, your baby's body, the whole of the baby's body is facing you. So you position the baby's belly against your own belly, and that helps with support. If possible, if you can't hold the baby, you can actually put a pillow on that to support your arms and your elbow. You can use put a pillow under to support yourself, just to maximize that comfort that you need and that comfort that your baby needs. So with your other hand, you cup the breast, scissoring in between the nipple, and with the thumb, gradually stroke the breast onto the baby's mouth until he or she latches properly. Let me take you back to the cradle. This is just exactly what we are talking, the cradle hold position. You can see how the breast is being cupped. So that's the way you cup your breast and put so that your baby will be able to latch properly. So this is attachments. I'm just showing you some like pictures so you'll be able to see what I'm explaining better. So this is basically attachments. That's the latching I'm talking about. Your baby's mouth should be able to cover the whole of the nipple and the areola. That's the only way breastfeeding and your nipples won't feel sore. If your baby latches properly like this, your nipples will not feel sore and you will not feel pain. And your baby as well will be comfortable. And breastfeeding, you efficiently breastfeed your baby. So still on breastfeeding positions, you could see from this illustration, like I said, you must use a backrest. You could see some bad positions and some are good. You can see the ones that are marked bad. You can see the ones that are marked good. So for you to efficiently breastfeed, if you're not comfortable on a seat, you can use support. You can use pillows to support your back, so you don't have lower back pain. You could use a footrest just to rest your legs, especially if your legs are not properly touching the ground, because you need to be comfortable for you to be able to breastfeed properly. So you can use footrest, you can use a stool to elevate your legs off the ground, just so that you can get that comfort you need. You can even use a pillow to support your elbow and your arms when breastfeeding, aside supporting your back, just so that your baby will be comfortable and you won't strain your hand so much. So you can actually put a pillow underneath your hands for you to breastfeed efficiently. So for those of you just joining us, we are talking about care of the baby after delivery. We've talked about the importance of breastfeeding, and we said that breastfeeding is important to the baby and also important to the mother. For the baby, it helps to build their immunity, it aids their growth and development, it helps them, it helps the baby, it helps promote bonding. They actually have the right nutrients. Breastfeed milk is important. Breastfeeding is important because you have the right amount of nutrients, the right amount of vitamins and minerals in this breast milk, pre-packed naturally. So you're not worried about whether your baby is gaining enough or whether your baby is not gaining enough. So on the part of the mother, we said it also promotes bonding. It reduces the risk of some certain cancers. It also helps the mother lose some weight after birth, because some people are usually worried about weight gained during pregnancy. So when breastfeeding, it helps you to burn calories, which in turn helps you reduce some weight. Also, breast milk is important to the mother because it releases hormone oxytocin, which helps the uterus go back to a smaller size. Usually, our uterus is the size of our fist. So it will help your uterus go back to that smaller size when it was not pregnant, because during pregnancy it stretches. So after pregnancy, it needs to go back to that smaller size. And on the other hand, breastfeeding also helps to reduce the risk of bleeding after delivery. Then we went on to talk about positioning during breastfeeding. So I said that positioning, the best position for breastfeeding is the one in which you as a mother and your baby are comfortable and relaxed. And for you to efficiently breastfeed, you need to be patient. You need to be aware of when, if actually your baby needs to feed. It's not just baby cries and you want to feed. Sometimes it may not be feeding. Sometimes maybe other things like wet diapers, extremes of heat, and extremes of cold. So you need awareness to be sure that this baby needs to feed, not just, oh, they cry, you want to feed. No. So that awareness, positioning, and comfort, and patience and comfort is what you need for breastfeeding. And I went ahead to show some positioning. I said there are various types of positioning for breastfeeding, but the one which is comfortable for you and your baby is the best position for you. So that we are not here to tell you, oh, it must be cradle position. No. We're not here to tell you it must be football hold. No. It is a position that is comfortable for you and comfortable for your baby that you should assume. But the most common type of positioning we could commonly see is the cradle hold, which we are all aware of. Even if we've not experienced it, we've seen people do it. Like basically you're just sitting on a chair, on a couch, or on a bed with a backrest. If you don't have a backrest, you can actually use pillows to support your back to prevent lower back pain. And then you carry your baby in the crook of your elbow. And the baby is facing you, baby's whole body is facing you. The baby's belly is against your own belly with your hand as a support. You could actually use a pillow to even support your hand, just so that it doesn't feel weary. So you can actually use a pillow to support your hand, and then you cup your breasts, and then allow the baby to latch in properly. And I said for you not to feel sore on during
We can't hear you. We can't hear you.
Okay, sorry. Can you hear me now? Hello?
Yes, we can hear you now.
Okay, I'm so sorry about that. So I'm talking of express breast milk here. So I said expressing a breast milk just simply means squeezing the milk out of your breast. It's almost the same thing as breastfeeding, but breastfeeding is just that you're giving this baby the milk directly from your breast straight into their mouth. But expressing breast milk is just simply squeezing the milk out of your breast so that you can store it and feed it to your baby later. So there are a number of reasons why we breastfeed. Usually, if the breast is why we express breast milk, usually if the breast is engorged. What is engorgement? You know, when you're breastfeeding, when your baby is done feeding, hormones are being released, and those hormones are sending signals to the brain to refill the breast with milk. So when the breast is being refilled with milk and it's not time to feed, your baby is not hungry, you just really fed not quite long, sometimes this breast becomes hard because of the milk that has been refilled in it. It becomes hard and painful. So you can't be waiting for your baby to be awake, or you can't be waiting for the next feeding for you to actually express this breast milk. So these are the reasons why you express breast milk. If the breast is engorged, which I will just explain now. If you're going to be away from your baby, that's another reason why you express breast milk. Sometimes they give us maternity leave, right? This maternity leave is not enough for us to achieve exclusive breastfeeding as recommended by World Health Organization, which is supposed to be at least 6 months, first 6 months of life. So obviously for those mothers who are not stay-home mothers, you have to go back to work and you want to actually do an exclusive breastfeeding. So that could be another reason why you have to express your breast milk. So if you're going to be away from your baby, especially when you have to go back to work, you can express breast milk and keep it at home. It could to be refrigerated and fed to your baby later. There's nothing wrong with that. And then most importantly, why we express breast milk is also to quantify what this baby is taking. Sometimes we breastfeed and after 1 hour, baby is crying again. You check diapers are not wet. You check this baby, the room temperature is actually moderate. It's not too cold. It's not too hot. And you're wondering, why is this baby crying? It could be that the baby is not even getting enough because you've been breastfeeding directly. And as they're feeding directly, you don't know what the baby is taking. You cannot say, oh, this baby took 30 meals. You cannot actually quantify and say, oh, this baby is taking 40 meals because you don't know. So sometimes we express breast milk to be able to know, is our breast even producing enough that this baby is taking? So that's just to quantify what the baby is taking. So that's another reason why we breastfeed, express breast milk. So how do you express? There are a number of ways to express. You can either express using your hands or with the use of assisted devices like the breast pump, which could be manual or electrical. So, sorry, please, can you see the image? So this
No.
Can't see
No, can't see. The image is not showing.
It's not showing. Whoa. Well, okay, let me try and enlarge it. Can you see it now?
You are not sharing your screen.
I'm actually sharing the screen. Can you see it now?
No, I
Share
can't
the
see
screen.
anything.
Okay. Share the screen.
I just did. I shared the screen now. Okay, let me just try. Let me share it again. Let me try sharing the screen again. Is it up now?
No.
No, we are not seeing it.
Okay, okay. I just shared it now. Is it up now?
Okay, yes.
Okay,
yes,
yes.
it's better now. I'm trying.
Okay. So like I said, you can either express by hand or with the use of assisted devices like the breast pump, which could be manual or electrical. So I just showed you, this is what I'm talking about. You can see this where the cursor is, that's an electrical breast pump. Some of them can be charged to be used later, while some of them you have to plug them directly to electrical sources for you to use them. And on the left, you can see the manual one, which you have to use your hand to inflate and deflate the bulb there for you to use them. So sometimes people ask, which is better? They are both the same thing. The only difference between the both of them is that when you're using the electrical device, one, you need power. And with the system of our power in Nigeria, you can't really rely on light source. But if okay, even if there is no light, you can actually use a generator, fine, you can go for the electrical, or you could use both. But the electrical works much more faster because it has levels, like it has buttons at which you can either increase the rate at which it expresses or decrease it. So you can either increase the pressure using the electrical breast pump when breastfeeding, or you decrease it. So it has levels at which you want to increase or decrease. And it also has a button where all it just does is to massage the breast for a while, because usually for you to express breast milk, you have to massage the breast first. You can use either a warm towel, just massage the breast gently, not to rub it so hard. You just massage it a little bit before you can actually start to express, either using your hand or the electrical pump. But the breast pump on its own, the electrical one, has a button that can do that massaging for you before you can now use the other buttons to either increase the pressure at which it's expressing or decrease it. While the manual one, on the other hand, does the same work. The only difference is that you are the one doing the work yourself. You have to press. You can see the bulb, the blue bulb on it. It comes in different colors and different varieties. You have to use your hand to inflate and deflate this bulb, and the pressure is not much. It is what you give that you will get. And it takes longer time using the manual one than using the electrical one to express this breast milk. So these are important tips you need to know before expressing breast milk. It's very important. We tell ourselves before you eat, when you use the toilet or after using the toilet, you wash your hands. So washing our hands is very important. It's not just washing our hands under running water. You have to wash your hands with soap and warm water for you to express, especially if you must express with your hands. You have to have your containers readily, containers to collect the milk, the collecting containers. You have to have them ready and clean. It's not when you want to breastfeed, you now start washing, because by the time you begin to wash, you need those containers to actually dry. So you have to have these containers ready each time you have to express. Then, very important, you massage the breast before expressing, because this will help the milk let down. This will help the milk come out more. So I showed you the breast pumps already, both the manual and the electrical. I'm going to show you how to express with your hands. So basically, if you are to express with your hands, this is what it looks like. Your hands have to be very far away from your nipple and areola. Even if you've washed your hands shouldn't come in contact with your nipples or your areola. Your areola is simply that dark area around the breast. So when breastfeeding, this is how you cup your breast. When expressing, this is how you cup your breast if you're using your hands. And this is where your container should be. Your container should be in front, and it has to be a clean container. So when expressing, wash your hands. Your container should be readily available and clean. If you're going to use your hands, this is the best way to do it. Avoid touching your nipples or areola, as you may contaminate the breast milk. I told you about positioning in breastfeeding. So basically the same thing The same position you assume when breastfeeding, you assume when you're expressing as well. If you're using the breast pump, you can see someone manually expressing with her hands directly into a container. You can see the lady using a breast pump. So some breast pump, you can actually express both breasts simultaneously at the same time using the electrical breast pump. But if you're using the manual breast pump, you can't do that. But using the electrical breast pump, you can actually express both breasts at the same time. And you have to be comfortable, because whether you're expressing or you're breastfeeding directly, it shouldn't be something that should be painful to you as a mother. You have to be comfortable. You have to assume a comfortable position for you to be able to achieve this. So you assume a comfortable position for you to express. So storing, we're going to storing of this breast milk. I'm sure you'll be wondering, what do I do with this breast milk if I express it? Yes, breast milk can actually be stored, unlike formulas that when you make them, if the baby doesn't finish it, you discard it at that point. You can't reuse it. You reuse them again. Breast milk can actually be stored in containers, sterilized containers, or in special breast milk storage bags. Yes, you can actually go to stores. There are breast milk storage bags. But if you have containers, sterilized containers, you can actually use them to store your breast milk. When breast milk are expressed, they can be stored in the fridge for up to 8 days at a certain temperature of 4 degrees Celsius or lower limits. But it's best to use this breast milk within 3 days. I advise to use your breast milk. Any expressed breast milk should be used within 3 days, because I'm sure our refrigerators at home, we are not sure of the temperature at which it is. And these refrigerators are multi-purpose refrigerators we use. So you cannot actually say you want to store breast milk there for longer than 3 days, at most 5 days, but longer than 3 days, you shouldn't be stored, because one, we are not sure of the temperature, and it's not like we have a special fridge that we say, okay, let's set this fridge aside for the breast milk. So it's best to use your breast milk, express breast milk, within 3 days. Another thing is best to store breast milk in smaller quantities to avoid waste. So yes, you don't store breast milk. You don't just go and buy, okay, because you want to be economical, you go and get a big container and store about 300 mils of breast milk in one container. No, shouldn't be done, because it's going to lead to wastage. It's going to lead to contamination. So you store breast milk in smaller quantities. You can decide to store it in, let me say, you can store 50 mils, because most of these bottles are calibrated. So you can store like 50 mils in each, or 100 mils in each. And this breast milk
I can't hear you anymore. I don't know if it's the network.
Can't hear you anymore, please.
Hello, can you hear me?
Yes, can hear you,
Okay,
ma.
The network is a bit bad. Sorry for the interruption. Okay, so like I was saying, you store breast milk in smaller quantities so that you'll be able to use them as a sitting so as to avoid waste and contamination. So that's what I was trying to explain, that these bottles are calibrated so you can decide you by the time your baby begins to feed, obviously you know the appetite is going to increase as day goes by. So you should be able to determine, okay, my baby is takes 50 meals at a sitting. You store 50 meals. You store it in 50 meals. If as the appetite increases, you store it in that amount. You don't just store maybe like 300 meals in one container. No, it's going to waste. And we wouldn't want that wastage. So in order to avoid wasting and contamination, you store in smaller quantities that you know if you're bringing it out, you're going to pre-warm and you just give your baby, feed your baby with it. So how do you pre-warm? Basically, you just boil water. You know, when you bring the expressed milk out of the fridge, you just boil water in a kettle, pour it in a bowl, and dip the bottle in that bowl. You don't boil breast milk. You don't microwave. Do not, for any reason, microwave. Don't say it's going to be faster. Let me microwave it. And no, please do not microwave expressed breast milk because you're going to destroy everything in it. So don't microwave. The best thing is just boil water, put the water in a bowl, then dip the bottle or the storage container into that bowl containing the hot water. Just give it like 5 minutes. 5 minutes is even much. Just a few minutes and it's pre-warmed. Then you can feed your baby with it. Then most importantly, always label and date your expressed breast milk before storing them. What do I mean by this? So if I express today, and I want to store it, if I express, I just label that one that I expressed with the date. You attach the date with it. Why do you attach the date? No, I told you can actually store breast milk longer, but at least it should be used within 3 days. So if I expressed yesterday and I expressed today, because I've actually labeled and dated the expressed breast milk, if I want to feed my child, the best one to use is the one expressed the previous day. Don't use the one you expressed that day, because if you don't use the one you expressed the previous day, it tends to stay longer. So that's the reason for dating your expressed breast milk. So if you expressed today, you had expressed yesterday, if you want to feed, you use the one you had expressed yesterday to feed. Then leave the one you expressed today. Then subsequently, if the one you expressed yesterday is exhausted, you can now start using the one you expressed today. So that's why you need to label your breast milk when they are being expressed, so as not to so as not to waste them. So that's it for storing of breast milk. Now we'll be going over to the do's and don'ts of basically just Cot Care. We are going over to Cot Care. So I'm going to be telling you the do's and the don'ts of Cot Care. So basically, you know what the umbilical cord is? Is that cord that attaches the baby to the mother. And you know, when a baby is delivered, we clamp this cord and then cut it. We cut off blood supply from both the mother and the baby. So usually there is a stump we leave there because we won't cut the entire cord completely. So that stump there should be taken care of. That we have cut it does not mean it shouldn't be kept clean. That we have cut it doesn't mean it shouldn't be kept clean. So that's why we recommend that cord care should be done. So due to lack of blood supply to this cord, that stump becomes shiny and yellow. And within few days, it begins to shrivel before it falls off. Usually between 10 to 14 days after birth, but can last as long as 21 days. Yes, I've seen people, it does not mean your baby's cord has to fall on that between the 10th and 14th day, no. Some babies' own can take longer, up to 21 days. So it's no cause for alarm if your baby's cord has not fallen off within the 10 to 14 days, because it can last as long as 21 days. All babies are not the same. Some might fall earlier than the previous one. So whichever one it is, you just have to be patient with the cord. It's going to eventually fall off. It mustn't be within the 10 and 14 days. So according to World Health Organization guideline, application of chlorhexidine gel once daily from the base of the stump to the top of the stump is recommended. So that's what World Health Organization recommends. But we in the hospital, even after applying this chlorhexidine gel, and this chlorhexidine gel is applied once daily. Remember, it's applied once daily. So usually we apply it immediately the baby has had his or her bath in the morning. But we still advise that we use spirit subsequently, methylated spirit, as often as possible, if possible 2 hourly, or with each diaper change. Reason being that if you apply chlorhexidine gel in the morning, subsequently you're going to change this baby's diaper, yes. Subsequently, some mothers are not comfortable, okay, my baby putting on one clothes all through the day, or a particular clothes all through the day. Some of them want to change. So during those processes, you would have contaminated the cord, and infection can begin to set in from there. So because chlorhexidine gel is applied once daily, we now recommend that, okay, to cover up for those lapses that we are going to change diaper, because diaper can contaminate the cord, because sometimes you put on the diaper, before you know it, the cord falls into the diaper, this baby urinates, urine may touch it, infection begins to breed. We now advise that you clean it with methylated spirit as often as possible as you can. You can do it 2 hourly, or if you can't do 2 hourly, with each diaper change, as you're changing the diaper, you clean with spirit, and you clean in the same way. For instance, you clean in the same way as you're cleaning with the applying the chlorhexidine gel. For instance, if this is a cord, and this is the top, this is the base. The base is the place connected directly to the abdomen. So if you want to clean the cord, you clean from this base, which is the base of the stump, the one closer to the abdomen, out. You clean from down to the top, not from top to down. Because if you're cleaning from top to down, what if there are contaminations here, you can actually take it down and it just begins to breed down there. So you clean from down to the top. That's the way you clean. So subsequently, apply methylated spirit as often as possible. It can be 2 hourly, or you can do it with each diaper change. So the don'ts of Cot Care. So most times it's normal with our parents or grandparents telling us, okay, this baby's cord, there are other forms, aside using all these things, let us apply things to it. No, anything other than spirit, anything other than chlorhexidine gel should not be applied on the cord. Avoid the application of animal dung. Yes, people use animal dung, that's the shit from animals like cows and goats, and apply it on the baby's cord. Please, for no reason should this be done on any baby, because you're just introducing infection to this child. You're harming the baby rather than doing good. And any other form of cream or concussions. Sometimes we have people tell us, oh, this cream works. No, anything other than chlorhexidine gel, other than spirit, should not be applied on the cord. Avoid touching or pulling on the baby's cord. Yes, like I said, most times when we want to do things, we wash our hands. You want to eat, you wash your hands. When you're taking care of the baby's cord, you also have to wash your hands, because if you don't wash your hands and you're touching this cord, you're going to contaminate it, because whatever microorganisms is in your hand can contaminate the cord. So avoid touching or pulling on a baby's cord. Do not pull the cord for any reason. Maybe because you see, oh, it's just a tiny skin that is holding it from falling off. You now want to help the cord fall off on its own. No, please do not pull on the cord for any reason. Even when you're cleaning it, you just gently raise it up and just clean from the base to the top. So always fold a baby's diaper to rest below the cord. Yes, when you're changing your baby's diaper, don't put the cord inside the diaper after you strapped it around the baby's waist. Don't put the cord inside the diaper, no. Rather, fold the diaper beneath it. Because if you put the cord inside the diaper, If this baby urinates or passes feces, it contaminates that cord and infection will set in. Always be gentle with the cord, very important. So always be gentle with the cord. So we're going over to signs to check for cord infection, because yes, sometimes we don't even know that the cord is infected and we've been cleaning, either because we've not been cleaning properly or just something we are not doing right, or we missed something. This cord becomes infected. So for you to know that this cord is actually infected, you will see some swelling, redness around the cord. You will see it will be really visible. That's to tell you that infection is going on, because inflammation will always make the area red and it will swell. You'll see some discharges. Usually not the discharge after the cord has been cut. Usually a day after the cord has been cut, after delivery. Sometimes the cord still has some discharge, but it's not usually yellow, it's not white. That is more like a blood stain, but it's not an active bleeding. That one is normal. But on no account should the cord now start discharging yellowish colored mucus or anything, or very whitish mucus. So if you notice any of this, you know that it is a sign of infection and it needs to be treated immediately. Or you now begin to see, after days after delivery, you're now seeing bleeding, blood at the end of the cord. That one is no longer, usually after delivery, it's normal that you will see blood stains, but not an active bleeding. But if peradventure you begin to see things like actively, like this cord is actually bleeding blood, you're seeing like heavy blood on the cord, then infection has set in already. And you now notice some signs of tenderness, pain in the area. Usually a baby will not tell you I'm feeling pain there, because they can't talk, they can't communicate at that point. But when you're touching it, you notice some signs, like not that you press it. Sometimes, usually, even when spirits touch them, they cry. It's normal because it's cold. But how do you assess for this pain and tenderness around the cord area? When you just gently touching that area, you notice this baby like crying, not their abnormal cries. The baby will cry and you know that this baby is in pain. So usually when you touch it, just touch them gently around that area and you begin to notice that they are really crying seriously and screaming. Then you know that there is infection already ongoing in that area and it needs to be treated. You see, either take this baby to the hospital to seek immediate help, either from the general practitioner or the pediatrician. So those are the signs to check out for cord infection. So basically, in a nutshell, if you want to take care of the cord, apply use of chlorhexidine gel. But before this application, always wash your hands, please. Very important. Washing our hands saves us a lot of things, saves us from a lot of contaminations and infections. So wash your hands. Apply the chlorhexidine gel. Okay. Sorry, please, can you mute your speaker? Okay. Always apply chlorhexidine gel once daily, immediately after birth, after having the morning bath. Then subsequently you clean with spirit. Can do it 2 hours. You can do it diaper change.
Wow, that's good.
So you check for signs of infection as well. And I already told you the signs to check out for. If the area is tender, if there is swelling, there is redness, if there are yellowish discharges, if there are blood stains around the cord area, then you know that infection has begun to settle and that child needs immediate help from the medical practitioner or the pediatrician. So don'ts of cord care, like I already said, avoid pulling on the cord, avoid touching the cord unnecessarily. Always be gentle with the cord. Do not fold the cord inside the diaper. Always fold the diaper beneath the cord. Those are things, don'ts of cord care. So now, the last thing on our
okay, arrives in 3 minutes. About 500 or 600 highest. Yeah. 500 to 700, not depend. What is wrong with this here? Ah. Okay.
Hello, Christabel. Hello. Hello. Hello, Christabel.
Allow that oil to hold milk. Start.
Please, can you mute yourself, madam? Can you mute yourself?
My husband is the best. Ah, he is the best.
No, I can't hear anything at all.
Okay, can you hear me now, please?
Yeah, it's
Yes,
better now. I can hear you now.
Yeah,
Okay.
you can go on.
All right.
Yeah, go on, and let's ask our questions to.
All right, please. Sorry for all the interruptions. I guess the network is really bad. I'm so sorry about that. So this is the last subtopic we'll be taking on care of the baby after delivery, which is bathing of the baby. Before we can take questions, if you have any. So bathing of the baby. So basically in hospitals, babies are bathed a few hours after delivery. However, World Health Organization recommends waiting for about 28 hours before the first bath. So usually we may not, in the hospital, we may not maintain these 28 hours. Reason being, depending on the time the baby was delivered. That's another thing. If you had delivered probably, let me say, early this morning, we won't bathe your baby. Rather, we'll do it in the morning. But at least we would have achieved some hours. It may not be up to 28 hours, but at least it would have been up to 12, 20 hours, up to 18 hours. But World Health Organization recommends that babies are not bathed immediately, because I noticed a lot of persons ask, okay, they deliver baby, they expect you to bathe the baby immediately. No, please. Babies are not bathed immediately. They are not to be bathed immediately after delivery. You have to wait about 28 hours. Even if you don't wait up to the 28 hours, you still don't bathe immediately. You just give a certain number of hours before the baby's first bath, because you're just exposing this baby. This baby has no form of producing enough heat and energy for themselves. So you don't want to expose them to cold at that first instance after birth. Secondly, for you to bathe a baby, you don't immerse a baby into water. Babies need sponge baths until their umbilical cords have fallen off, and then for the male until their circumcision has healed. You can't bathe them, dipping them into the water. There are various forms of bathing. There are various ways to bathe a baby. So for you to bathe a baby, basically, is a sponge bath we give babies after delivery. And this bath, we don't give them immediately the baby is delivered. We leave the baby for a certain number of hours before giving them their first bath. So babies need sponge baths until their umbilical cords have fallen off and until their circumcision has healed. According to American Academy of Pediatrics, babies are to be bathed 3 times in a week, as long as the face and the perineum or the diaper area and the neck are clean. So which means they recommend you bathe babies alternate days to prevent exposing them too much to cold, because they don't have enough skin. They can't make up for the heat loss. So American Academy of Pediatrics recommends you bathe your baby 3 times in a week. I see some people, once the baby, they want to bathe the baby twice a day. No, please, it's not done. Even if you want to bathe your baby every day, not twice daily, please. But at most 3 times in a week. As long as you can use just a towel to clean the face, as long as you can clean the neck area and just the diaper area. So what are the benefits of a sponge bath to a baby? 1, it promotes bonding. Just like we said with breastfeeding. Breastfeeding promotes bonding, same as sponge bath. A sponge bath promotes bonding as well between the mother and the baby. A sponge bath improves the success of breastfeeding. Usually when we are stressed and you have a bath, you have, be it a cold bath or a warm bath, depending on the one we need at that point, you feel much more relaxed. You feel fresh, you feel like you're brand new. Same thing happens with a baby. So when you give them a sponge bath, it improves their breastfeeding. It also helps with the success of breastfeeding. Another benefit of a sponge bath is that it keeps the baby's skin from drying out. So you're not worried about, this skin is too dry. So it keeps the baby's skin from drying out. So what are the requirements you need for a sponge bath? 1, you need a baby body wash, which is the liquid soap, or depending on the one you're using, or tablets. You need a towel. You need 2 washcloths. You need a bowl of warm water. And that warm water, to test for the desired temperature, you have to use a bath thermometer. There's something we call a bath thermometer to check if the temperature of the water is actually at the right. But if you don't have a bath thermometer, you can just use the back of your elbow here and dip it into the bowl of the warm water and ascertain if it's actually okay, if the temperature is okay. So you have several cotton wool swabs, you have lotion, a diaper and wipes, a suitful change. A suitful change is just the clothes you want your baby to put on at that point after the bath. Then you have the chlorhexidine gel and then comb. Those are the requirements for your sponge bath. Now, how is it done? First of all, you arrange your items within reach. Not the one that your soap is right there at the door and where you're bathing your baby, it's here. No, everything you have to arrange them in the order and manner as you're going to use them. And it should be within your reach before even you undress your baby. So you wash your hands and undress your baby. So when you wash your hands and undress your baby, the body towel we requested for, that is what you place on your laps. The body towel is a very big one. So you place it on your laps while you undress your baby. When you undress your baby and you've washed your hands, you start with the eyes. Start with the baby's eyes. So you gently wash the baby's eyelid,
So
You using the soft washcloth. So you clean from the inner canthus, that's inner hair out, not from out inner. You clean from out inner, then outer. The same way you do for the left, in, out. And that way, when you're cleaning, you use two different sides of the washcloth. If you use this edge of the one edge of the washcloth to do one of the eyes, for the other eye, use a different edge of the washcloth to clean. And you're using just a washcloth with clean water, not soap. No soap, please. Because you can introduce soap. The soap can actually enter into the eyes. You're just using the washcloth with clear water, no soap added, please. So I already said you start with the inner corner of the eye and wash towards the ears. So inner, then outer, then towards the ears.
What's on here now? I should try it now. Jesus will spoil this thing. Man.
Please kindly mute this Mrs. Chiamaka. Please mute her. I think you can mute her from your end, nurse. Please kindly mute her.
37. I'm not in the platform.
Mọ́mí ẹjọ́ ẹ mute ẹjọ́.
Hello, mothers. Hello. Hello.
We are here.
You're here. Okay, please. I guess Christabel has problem with her network. So if any one of us have questions, can we ask your questions now? My name is Mrs. Adeshino, the matron of Mother and Child Hospital. Hello.
Hello, good afternoon.
Yes, good afternoon.
My name is Mrs. Sandra.
Yeah.
I would like to ask, thank you very much for the lecture. I would like to ask I wanted to find out when we will have lectures concerning the care for episiotomy for mothers.
For mothers. That topic will come during the time you are having a topic on labor.
Okay.
Yes, you know, after the delivery, you give episiotomy.
Yes.
So when you are having that topic, you have a talk on episiotomy.
Okay.
Which is very soon.
Soon, please, because
Yes,
I'm almost due.
Yes,
And my last
soon.
experience with my episiotomy was not very good. So that's why I'm asking.
Anyway, let me give you something. Tell you some things about the episiotomy. Usually,
Okay,
it is given when your baby's head is about coming out, and after
yes.
the baby is delivered, that episiotomy will be repaired. We suture it. Sometimes we use catgut to suture it, and this catgut melts at body temperature. If you sit on hot water, it can melt the suture before your wound actually heals. So that's why we say with episiotomy sutured with catgut, you don't use warm water or hot water for sit bath. We ask you to just clean yourself after using the toilet or weeing, clean with pad or toilet roll, and keep yourself clean. Maybe like a week after, you can sit in warm water if you want to, but it's not necessary. The wound will heal by itself within 1 week. Are we okay? Hello? The network is something else.
Yes, thank you, ma.
You're welcome. Any other question on breastfeeding? Engorgement?
Hello, good morning.
Feeding your baby? Good
Hello.
morning. Yes, good morning.
My name is Mrs. Yemisi. So
Okay.
I would like to ask, what is the proper age to stop breastfeeding for a child?
Proper age to stop breastfeeding.
Yeah.
Some do it as some do it up to 2 years. Some do 1.5 years. Some do 1 year. Some do 6 months. But we say, as long as you are producing and you have the opportunity, the time, you can keep doing it. But at a point, the breast milk alone will not be sufficient for your baby. You need to wean your baby off, onto other feeds that will help your baby to grow.
Mm-hmm.
Okay.
Yeah.
So can we say it's a maximum of 2 years, right?
Yes, if you can do it, maximum of 2 years, if you can do it.
Okay.
But it's
Thank
rare.
you so much.
Hello.
You're welcome. Hello?
Hello.
Yes, I'm listening.
Okay, I actually read it somewhere this week, and I want to confirm that fact. I think that cleaning the umbilical cord, there is not necessarily to use anything to clean it. That is just leave it open, use a clean cloth or cotton wool to just clean it every morning, and don't cover it with paper. Is that true or right? Because I know with my previous babies, we normally use methylated spirits for the first two. The third one, we use something chloral, something gel. But my experience with that gel was not.
Gel. Yes, okay.
Yes, it make it very, very long to dry. For me, I prefer the methylated spirit. But where I read it this week was saying that there is no need to use all those things. There is just need to use clean clothes and clean water to clean it, and it will dry off and fall off. I just want to confirm that statement.
Using ordinary water is not too good because spirit is a drying agent and it sterilizes. It prevents infection. We use what is this now? We use after you wash your hand, you use methylated hand sanitizer. Do you know why you use hand sanitizer? When you use it, your hand is wet initially, and after a while, it dries up. So the essence of using spirit to clean that after your baby has had his bath is to keep the cord dry. Like she said, after cleaning with spirit, after a while, the cord will start to shrivel and dry and then fall off. But if you use ordinary water, it's not going to have that drying effect on it. And in fact, it can make the cord to become soggy. And in fact, if the water, you don't even know whether the water is clean or sterile, it can cause infection. So please, it's better to use methylated spirit to clean the cord. Like she said, base to the top.
Okay.
Yes.
Okay.
And
okay.
within 1 week, depending on it, it will fall off.
Okay. Thank you.
Good afternoon.
Good afternoon.
Okay, please, I want to ask a question in relation to what the lady just asked. Does it mean that water should not touch the cord at all?
Of course, water should touch it. When you are giving your baby a bath, you pour water on your baby's body and it touches the cord, it cleans the cord. You wash it, it cleans it. But, to keep it dry and to enable it to fall off on time, you use methylated spirit. Ordinary water will not make it dry.
Okay. Then also, when cleaning the baby, when the baby is just born, when cleaning the baby after birth, should Can we add soap to the water?
So,
Or it's just water and
you mean bathing
the
gel?
washcloth? Yes.
You mean bathing gel? Yes, you can use bathing gel.
Hello?
You can use bathing gel for your baby. Yes.
Okay. That's after the baby is born, after birth.
Yes, immediate after the baby is born. You can, like you said, 8 hours after, your baby can have a bathing gel for the bath.
Thank you.
You're welcome. Any other question?
Good afternoon, ma'am.
Good afternoon.
Yes, ma'am. Please, I would like to ask that after the cord falls off, is it advisable to mop the baby's navel with hot, like a hot water or hot something after the cord has fallen off?
Has fallen off. Traditionally, that's what our mothers do. Once the baby, even before the cord falls, they put stone inside a piece of paper, a piece of cloth, and put it on lantern, and then put it on the navel. We don't advise that. You can actually infect the baby's navel. So we don't encourage that. What you should do when the cord falls is to keep cleaning with methylated spirit.
Okay.
Until that area closes off.
Okay.
All right. Hello.
Hello?
Thank you.
Hello,
You're
ma'am.
welcome.
I'm sorry, my network is really breaking. I don't know
Christabel,
why.
you're back. All right.
Thank you for holding the class, ma'am.
You're welcome.
All right.
So let's turn our questions into Christabel.
Yes, ma'am.
Okay. Please take their
All right.
questions.
So I just. Okay, ma'am. No problem. Okay. Does anyone have a question before I finish up with the bathing of the baby? Or I should finish, then we can take questions. Hello, Ma, can you hear me? Okay. So I want to quickly finish up with bathing of the baby. Network has been really bad, so I had to switch to my phone now. So I hope this one stays. So how it's done, I already talked about the eye. When you want to clean the eye, you do without soap, just the washcloth and clear water. So you clean from the inner, outer, and use 2 different ends of the washcloth for both eyes. Sorry. So you clean outer, inner to outer, then to the ears. After which, you do the face. So you're still using the washcloth in your hands, no soap on the face, please. You just use the washcloth and the clear towel. You just, clean the baby's face, no soap as well for the face. Then for the ears, you just wash the outer part of the ear with the washcloth, which is wet already with clear water. Then when you do that, you just use the body towel. Obviously, this baby is on a body towel, which is a bigger one. Then use the body towel to dry those parts which you avoid, which is the face, the eyes, the face, and the ears. So do not use a cotton swab inside the baby's ears, please. Most times we buy that cotton swab, but please do not use them inside the ears. It's not advisable, as it can get stuck there. Infection. It's easy for them to it's easily for them to get infected. Their ears to get infected. So the next thing after the eyes, face, and the ears is the hair and the scalp. So you pick your baby. Like I say, you don't dip the baby. You don't put the baby in the bath. This baby is on your laps, and not just on your bare laps. There's a body towel on your laps. So you don't, because you don't want to expose this baby for too long. And all these things you're doing, I'm saying them slowly, but you're not going to be doing them slowly because this baby don't need to be exposed for too long so they don't get cold. So you're actually doing it. I'm just taking it step by step, but actually in the sense, you're not going to do it more than 5 minutes. Even 5 minutes may be too much. So for the hair and scalp, so while you pick your baby, I would have loved to share the screen, but I'm not using the system now. I wanted to show you a picture, but probably I can, you can check the previous lecture. It's actually there. So for the hair and the scalp, you pick your baby. When you pick your baby, you support the head, baby's head and the back. So why the baby's buttocks will actually be resting here on your elbow, will actually be resting here. So which means your baby's head is here on the palm of your hand, while the back and the buttocks are resting here. So, but actually you're using your left hand for this so that you'll be able to support the baby. So holding your baby that way will give him a sense of security. So you wet this baby's head with clear water. That's the first thing to do. You wet the baby's hair first. So when you wet the hair, you just take a little amount of shampoo, of the baby shampoo. That's the body soap. You lather it a little bit with your hands, not scrubbing vigorously like we wash our hair as adults. Their hair is very tender. They are still very young. So you don't wash vigorously. Just lather it gently, smoothly, just a bit. Then you put soap. You can still put another soap. That's if you wish to, after using the shampoo. But if you don't use the shampoo, if you don't have a hair shampoo, you can just use your soap, lather it a bit, wash. Then you rinse the baby's hair using the towel, including the soft spots. You just rub gently in a circular motion. So you just rinse off the soap, then use the washcloth and also rinse off the remaining amount of soap. Then you now pat the head dry with the towel. After the head, you're doing the body now. So basically that baby is still on your laps now, back to your laps. You're no longer carrying the baby this way. So the baby is now on your laps, on the body towel. You now use your hand, you collect the baby's body wash or a soap, depending on the one you're using. You're using your hands now, not a washcloth first. So your hands first, you put the soap on your hand, then you start gently massaging the neck of the baby. You start with the neck, then you lather from the neck, you now gradually go down to the baby's entire body, ensuring that all the skin folds, our babies usually have skin folds, sometimes at the neck, some of them have skin folds here. In between all the skin folds, even on their thighs, on their groins, you just use your hands, lather the soap, gently massaging the whole body. So even if it's a boy and you get to the circumcision area, do not pull on the circumcision site. Do not pull on the foreskin just because you want to clean it. When you get there, just massage the legs down. Don't touch. You have no business with the circumcision site, as you could enjoy it if you say you want to go and begin to wash it. No, you don't have any. Just wash the perineal area, the back, using your hands. So when you're doing this, when you would have done this with your hands, then you now use the washcloth to rinse off, wet the washcloth. That's because obviously we have to. So once you've made use of one, which you use for the face, the ears, and the hair, you discard that one. Use the second one for the body, for the neck and the body, and every other area. So you now wet the washcloth, use it to dry, clean off the soap, then dry the baby with the soft towel. Next thing, you apply your lotion, do a Cot Care. We already talked about Cot Care. So I told you that usually the chlorhexidine gel, we apply it immediately after the baby has had his or her bath. So that one is applied once daily. You now do your Cot Care, you wash your hands, apply the gel for that morning after the bath, then subsequently, which you can use spirit, then dress your baby up according to whatever you want the baby to wear. So here are some safety tips when bathing your baby. At the initially, when I started with bathing, carrying out the procedure itself, I told you that you have to ensure that everything is within your reach. So these are safety tips for you. Always ensure your requirements are ready before each bath and they are within reach, where you can easily reach them. Not that one will be far and the other one will be here that you need to be calling somebody to come and help you bring it. No, everything has to be arranged within your reach. Then the temperature of the room should be warm. Yes. If your windows are open, you may need to close them just so that you could provide more warmth in the room so that this baby is not exposed to cold for too long. So always keep your baby warm. Always keep firm hold on your baby because their body is soapy and obviously they are going to be making some movements and they can easily slip. So safety tip, keep a firm hold on your baby as their bodies are soapy and slippery. So always keep one hand on your baby if you must turn away. Yes, sometimes you maybe we just accidentally forgot, something is behind me, you get, and I really want to use it. If you must look away from your baby, please place one hand on your baby. You should always have one hand on your baby so they don't fall, for safety reasons. Then, very last but not the least, most importantly, never leave your baby alone during the bath. Never. If you must bathe a baby, you must be there. If you're not ready to have that bath, do not bring the baby close to the bathing area for any reason. So never leave your baby alone during a bath, not even for a second, because they can easily drown even with an inch of water. Yes, babies can drown with an inch of water. So that's the reason why you never leave a baby alone during a bath. And with this, we've come to the end of bathing, sponge bath for a baby after delivery. So I would like to take questions now if you have any. I'm sure my matron has answered some of the questions you may have, but if you still have questions, likely questions you want to ask, you can ask and I'll answer them for you. I'll be glad to answer them for you, please. So questions, please.
Hello, good afternoon.
Good afternoon, ma, please.
Okay, my name is Amaris, and thank you very much for your time and the lectures. But I would like to ask if it's advisable to bathe the baby just 3 times a week. For how long are you going to do it? Is it just that period of delivery, or you do it for 6 months, or for how long?
Okay, not for 6 months. Actually, yes, I got your question. It's not to be done for 6 months. At least, at most, it should be done for 2-3 weeks. As they are still very tender. Yes.
Okay, thank you.
It's not for 6 months.
All right.
Any other question, please? Questions, please. You're free to ask questions.
Good afternoon. Please, there are questions in the chat room.
Questions in the chat room. Oh, I just checked. I couldn't find any. Okay. Actually, can't see any chats here. Questions yet.
Okay, I would like to ask a question.
Okay.
Okay. You know, when mother-in-laws or mothers come for omogo, there's something we call omogo in our ethnic group. They tend to fling the baby while bathing the baby. Is that appropriate?
No, please, it's not approved. Even shaking a baby, jerking a baby is not approved.
And they also raise the sponge, the washcloth with hot water directly on the navel from the top on the baby's navel.
No, this is not advisable.
Okay. Thank you.
Just wash. The basic Cot Care you need applying the chlorhexidine gel or cleaning with spirit, please.
Okay. And they also apply mentholatum around the stomach and around the navel. Is that also appropriate?
It's not appropriate. Anything mentholatum, in fact, anything that has menthol in it is not even It's not advisable to keep it beside a baby because it has a way of making them. Yes, it has a way of making them come down with jaundice. Anything that has menthol in it is not advisable. You can actually read it up. Mentholatum is not advisable around a child or for any reason. Should not be applied on a baby. Not just the cord alone. For any reason, is not applied.
Okay. And for the eyes of the baby, we notice that they always also come up with this eyeliner that should be around the baby's eyes.
I know most people do that, but no, please. It's not. Most people do it. I've seen people that do it. It's not, please.
Okay. Thank you. That's all the questions I have to ask.
Okay, I can see some questions coming in. How can a pregnant woman prepare for breastfeeding before birth? When does one start nipple cleaning? What's the best way to sterilize feeding bottles? Okay, so first question there is how can you prepare for breastfeeding before bed? Yes, usually can actually prepare for breastfeeding before bed, especially for those that have retracted nipples, like your nipples are inside. It's usually best you start preparing earlier. Like your husband can actually help to suckle on those nipples. And I think we even have a class on that. We had a class on that. If you go to our YouTube page, for every information you need concerning preparing of the breast and the nipple care is there, please. I think you will get all the informations you need there. I won't be able to explain everything to you here, but preparing the breast before delivery and even before you start breastfeeding is actually is very important, especially for those that have retracted nipples or have one form of problems with the breast. So most times you can actually, once in a while, your husband can actually suckle on your breast. I know sometimes I get people say it's sore, it's this, but you just have to. Those are ways that the breast can be prepared before breastfeeding or before you even deliver. So you can actually, okay, when does one start cleaning your nipple? You clean your nipple immediately. You have your bath every day. You can actually, even me, as I even haven't not delivered, most times I clean my nipples. So you can actually clean your nipples. It mustn't be because you want to breastfeed that you start cleaning your nipples. No, you actually clean your nipples. You can decide you can be cleaning your nipples on a daily basis. So there's no better time to just start saying, okay, I want to start cleaning my nipples, please. What's the best way to sterilize a feeding bottle? Yes. Usually, most people have sterilizing units. Good for you. You can actually use a sterilizing unit. But this sterilizing unit comes with a sterilizing tablet called Mitten. Usually, for me personally, I usually don't even advise that Mitten because most people won't rinse it off completely. Because this tablet is not supposed to be, it's just for you to sterilize, and they are chemicals. So you use them, but do you actually rinse them properly? So it's not enough to say, oh, I have a sterilizing unit. I use the Mitten tablet and I've sterilized my bottles. No, it's not enough. So even if you sterilize, how well have you sterilized those bottles? So usually, most times our advice, you boil water. After washing your bottle, you've rinsed it very well, rinsed off the soap. You boil water. You can boil water, pour it in a container that has a tight lid cover. Put your bottles inside there and pour the hot water in it. Soak them for like 5, 10, 15 minutes. Because this, at least you're sure of the temperature of the water. But your sterilizer, what's the temperature? The sterilizing tablets you're using, how well did you rinse them off completely from the bottles? Because sometimes you find out if you smell the bottle, you could still perceive the scent of those sterilizing agents, which is not advisable because they are chemicals. They can get into the baby's body system. So if you must use your sterilizer or use your Mitten tablets, please do well to rinse them properly. But I advise, aside that, you can boil water after washing your bottles and all that and rinsing them properly. You boil water. When the water is properly boiled, you pour it in a container that has a tight lid cover. Put your bottles there, soak them for like 10 to 15 minutes. Please talk on freezing breast milk. How long can you keep those for? Yes, actually, it's advised you can actually freeze breast milk. But like I said, with the situation of power in this our Nigeria, and no matter how well we feel our fridges are working, if it's not at a certain temperature, please do not leave the breast milk for more than 3 days. But if you feel okay, your fridge is actually working and you can actually freeze this breast milk 5 days at most, in as much as they said 8 days, 5 days at most, please. And when you freeze this breast milk, if you must use them, if you know you're going to use them, don't just bring it out with all the block in it and then put it in a boiled hot water, please. You bring it out, allow it to defrost. When it's properly defrost and you're sure there is no ice in it again, before you can then boil water, put in a bowl, then dip the bottle inside. So if you're going to freeze, please, you can keep at most 5 days. But if not longer than 3 days. Okay, so What to take to enhance lactation? They are basically, what if you want to enhance lactation, basically there are a lot of factors that come into play in terms of lactation. One, in that sense that, okay, I've delivered, I need this breast needs to produce milk. That's why we initiate breastfeeding immediately after delivery, because that will help to improve lactation, one. Then secondly, water, taking fluid, not just water, sorry, taking fluid, anything liquid. It can be tea, it could be pap. It mustn't be, some people tell you I've been taking pap, no, it mustn't be pap only. Water, clear fluids. Take water, take tea, take pap. Some people take lactation cookies and it works for them. It won't work for everybody, but still, you can still take your lactation cookies if you have, but most importantly, fluid, liquid foods and all that. I'm not saying you shouldn't eat your solid food, but at least you should be able to take liquids more often, like liberal fluid intake and the rest of them. Okay. Are we to come with delivery kits, or is it part of the antenatal registration? Oh, sorry, for the delivery kits, actually, there's a list of things you're expected to come with when you're due for delivery. Please do well to ask for the list when you come for your next antenatal visit. We have a list of things, of requirements that you should come with before your delivery. So whenever you're around, please do well to come to ask any of the nurses for it, please. Mrs. Rachel Ashafa, please do well to ask for the antenatal list, for the delivery list, sorry. You come along with it when you're due. So next question, please, for male child, what do we need to clean? After, no circumcision, is it just spirit or what? No, please, after circumcision, immediately after circumcision, you don't need to apply anything on the circumcision site, nothing. Just change your baby's diaper when it's wet. Just change it. Basically, change the diaper care. The perineal care is the most important thing at that point after circumcision. You don't need to apply anything on it. You don't need to clean it. Just bathe your baby, dry the area. Don't pull on the circumcision site. Whatever is applied there is a plastic. What the plastic that is there will actually fall off on its own. So you don't need to apply anything. You don't need to clean it. Just make sure that the perineal area is always clean, because if the diapers are wet and you don't change them on time, the urine begins to decompose and infection breeds in. So basically, the most important thing at that point after circumcision is the perineal care. So always change the diaper as often as possible, especially when they are wet or soaked. So no spirits, please. And don't apply any other thing to it. Please, ma, is it good to massage a weak baby's body after bathing the child? Yes, you can actually massage a baby's body, but not the vigorous massage we do. Sometimes the kind of massage we do, you think you're doing it for an adult. These babies, their bones are still very much tender. While you're even applying their body lotion, you just give them a gentle massage. You don't need to be vigorous about it. So you can actually do that, but not the one that we do that you now want to stretch even the bones and everything. No, just a gentle massage. Even just make applying lotion. You're already massaging the body itself. So you don't need those intense massage. These babies are just a few days old. They've not even done anything. Their bodies are still very weak. Their bones are still very tender and all that. So you just a gentle massage. You can even do it while you're just applying the lotion or oil, baby oil. Just, massage it, and that's all. So you don't need any vigorous massage. I think with that, I think that's the last question here. Okay, no, I missed one question. At 34 weeks pregnant, babies having hiccup. Okay, matron, I think I'll direct this question to my matron. I think she'll be in the best position to answer it better for your own understanding. Matron, are you still there? Matron? Hello, ma. I think she is no longer there.
Hello?
Hello. Okay, there's a question. Answer.
Hello?
Hello, Ma, can you hear me?
Yes, I can hear you.
Okay, there's a question there on the chat. I would like you to answer. At 34 weeks, 3 days, is it normal to feel a baby hiccup at 34 weeks plus 3 days?
Yes.
Is it normal to feel a baby hiccup in the womb for 5 to 10 minutes at least, 3 to 4 times a day?
Oh, I've never heard of that before.
Okay.
Does that person have the experience?
Yes, that's the question. She said at 34 weeks, 3 days, is it normal to feel a baby hiccup in the womb for 5 to 10 minutes, at least 3 to 4 times a day?
A day.
I've not
hiccup?
heard that. Yes.
Hiccup?
Yes, baby hiccup. No, hiccups.
No, we know of kicks, we know of moves and all those, but we don't know of hiccups. Yes. We don't know of hiccups.
Okay.
Better still, if the person comes to the hospital, we can ask the gynecologist, the obstetricians rather.
Okay, we can actually although hiccups are just normal fetal, they are actually normal fetal reflexes. So maybe please do well to ask your gynecologist when you come for your antenatal visit, please. Okay. Hi, please. This is my first meeting. How do I get the recorded copy so my wife can watch? Is there like a WhatsApp group? Okay. From Damilare Osibanjo. Okay, Mr. Damilare, please. There's no WhatsApp group, but you can actually get a recorded copy of this. You can actually watch it on YouTube. We have our YouTube page, Mother and Child Hospital. You'll find a list of all the antenatal classes there, and your wife can go through them, including this particular one. It's actually there. So your wife can actually go through them and make her ask questions if she has any, whenever she comes for antenatal, or ask during the next antenatal class. Okay, at 39 weeks pregnant, 3 days and having cramps, are these still Braxton Hicks or early signs of labor? If you're actually having cramps, I wouldn't really know how intense it is, but for you to be 39 weeks, 3 days, possibly early signs, labor signs are already there. So I advise you come into the hospital, because I'm not with you. It's only when we see and assess that we can actually ascertain and say, yes, you're actually in labor. But I think you should do well to come in and for a checkup, so we can actually ascertain and be certain is labor signs. But I'm positive is actually a labor sign, but depending on how the cramps are, the intensity and the consistency. So I wouldn't really say, because I'm not seeing you. And there are a lot of other assessments you may need to do, like the vaginal examination, to be sure that signs and labor has kicked in place. So if you don't mind, please do well to come into the clinic. Let's for further examination and be sure that you're actually in labor. Please, if expected due date is on the 40th week of pregnancy, when later should you expect natural labor pressure, or does that mean one should be ready for inducement? Okay, if you're at 40 weeks of if you're at your 40th week of pregnancy and you're not experiencing any signs of labor, nothing is actually going on, you may really need to come into the hospital for us to also examine, not just to quickly start an induction. Sometimes we may need to, if there are no signs at all, if you're not showing any signs, we may need to induce you. But before we can actually say, okay, you're fit for an inducement, or before we can actually conclude and say, okay, we're going to do an induction, you need to come in for us to examine you, not just having other maybe the cramps and the rest. There are other signs that you may have experienced that you may not even have known that those are signs of labor. So please do well to come in so that we can actually examine you and ascertain whether or not you're fit for an induction, or we could give you a few more days to actually wait for you to fall into labor. And if that does not happen, then you may go in for an induction. So please do well to come in for and examination. So I think that's the last question on the chat room. So in the absence of any other further question, please, I'd like to thank you for your time and your patience. And really sorry for the network issues today. It's been really bad. That's why I had to switch to my phone. But all the same, thank you for your time and do have a lovely weekend. I appreciate each and every one of you. And I pray that God will see you all through your pregnancy. And at the end of the day, you will go home smiling with your baby, with your healthy babies. Thank you very much and do have a lovely weekend.
Thank you.
You're welcome.
Thank you.
All right.
Thank you, Christabel.
All right, ma.
Thank you, Christabel.
All right, ma. Thank you very much for your time and patience.
And you too, we are grateful.
So this lecture, if you want to go through them, because the network has been breaking and it's been making us go back and forth. So you can actually have access to them on YouTube page, Modern Tutor. So please go through all the classes. And for those asking for their breast preparation, please, we have a lecture on that, and it's also there on the YouTube page. And it's very important. There's no information I'll give you here that will be enough. So it's best to listen to the lectures, especially for the different kinds of breast, please, for the preparation of the breast for birth and delivery. So just do well to go through them at your own time and space.